Treat bronchitis in babies. How do you know if your little baby has bronchitis? Some of the symptoms include the following: incessant dry coughing, breathing difficulties, wheezing and squeaky noises while breathing, stuffy nose, recurrent mild fever and poor appetite. Do know that male babies have a higher tendency to develop bronchitis, and those who are given milk formula instead of breast milk are also found to be more susceptible to this condition. Another factor that contributes to the development of bronchitis is pollution and living in a smoky environment. If you suspect that your baby has bronchitis, here are some of the guidelines for treating him. Take your baby to a doctor immediately. This is very important, as bronchitis in babies is a very serious ailment. The doctor should prescribe the best medication to address your baby's condition. Never try to give medications to your baby without consulting the doctor. Position your baby's head so that it is elevated compared to the rest of the body. This will help your baby breathe more easily. Keep your baby in a very clean room with proper humidity. It's very important during this time that your baby stays in a very clean room that's as free of dust as possible. You could also install a humidifier or a vaporizer in the room to ensure that the air that he is inhaling is not dry. Moist air also helps loosen the mucus from your baby's airways, and will help relieve his coughing. Do make sure that you clean the vaporizer or the humidifier daily to prevent mold growth. The adult who is taking care of the baby should also not be suffering from colds or flu himself, as he could infect the baby and thus worsen his condition. Finally, make sure that the room he is in is away from any type of smoke, allergens, and chemical smells. Continue to breastfeed or formula feed your baby. Even if your baby seems to have a poorer appetite, you have to continue feeding him as per regular schedule. It's important that your baby be hydrated properly and that he receives proper nutrition to help accelerate his healing process. Give your baby his medication during the proper times and with the proper dosages. Stick to your doctor's prescribed medication and schedules, yes, even if the baby seems to be well already. Some of the medications that your doctor may recommend include expectorants, to loosen the congestion in your baby's airways, antibiotics, if the bronchitis is caused by bacterial infection, and acetaminophen, to ease sore pain and to reduce fever. Again, whatever medication you give your baby must be prescribed by the doctor. Observe your baby's progress. Keep a close watch on how your baby is doing. You should watch out for signs that your baby's condition is getting worse. Some of these signs include the following: vomiting, increased fever, rapid and/or shallow breathing, and lethargy. These are signs that you should take your baby to the doctor for further treatment. If you notice blue discoloration around your baby's fingernails or lips, you should take him to the emergency room right away. Remember, bronchitis in babies is a potentially fatal condition which may eventually lead to pneumonia or other more serious respiratory ailments. It's really up to you to make sure that you have your baby treated in the soonest possible time. Good luck, and hope this helped.